Hey there. So this is chapter 7, part 2, all about bone development. It should be fairly brief. We'll see how that goes though. All right, so let's start it. So bone development is also called ossification. All right, this is referring to the formation of new bone tissue. So formation of the skeleton actually starts to begin in about month 2 of development. I won't ask you that number, it's just there for your curiosity. So we do have a little bit of skeletal development in the womb, all right? But in the womb, you're still mostly cartilage for most of that 9 months. Okay, eventually the skeleton is going to start to and so we're going to talk about that process. Postnatally, bone growth will continue, but understand that at birth, you are most of that cartilage has turned into bone, with the exception of a few places. So once you're born, though, you should pretty much be ossified, but you will continue to have another kind of bone growth from birth up until early adulthood, and that would be length, okay, growth in the length of bones, okay, and so the growth in the length of bones works a little bit differently compared to when you're in the womb, okay, but we'll talk about that. So in general, yes, we're having ossification happen from about month 2 of life up into early adulthood. And actually, even beyond adulthood, you can still have a continual growth of bones very slowly, particularly in the face. All right, so facial bones do have a growth, sort of a continual but very slow growth throughout life. And part of the reason for that is because, well, we use our face a lot. We're using facial expressions a lot, and that sort of puts stress on our bones and stimulates bone tissue activity in terms of development, even later on. You may notice that elderly people, if you look at like a picture of someone when they're, say, I don't know, 80 or 90, and you look at a picture of them when they're like, I don't know, 30, the features actually look a little bit larger, okay, in the face because there has been some facial bone growth all the way up till that time. So bone remodeling, all right, bone remodeling is something that's throughout life, all right. Bone remodeling is sort of similar to how ossification or bone development happens, but a little bit different. Okay, so basically, this is demonstrating to you that bone tissue is really, really flexible, and bone tissue, even beyond normal bone growth and normal bone development, even beyond that, bone tissue continually remodels itself throughout life. And that's going to be based on activity of osteoblasts and osteoclasts and how they complement each other or how they outpace each other. Okay, so bone remodeling is representing how bone tissue responds to your lifestyle, basically. Okay. And then repair, of course, bone repair. Bone is very good at repairing and healing, and this can happen throughout life. So yes, as an early fetus, all right, the skeleton is hyaline cartilage. Okay, early in development, there is no bone yet. It's just hyaline. And this hyaline cartilage will eventually be replaced with bone tissue. So now there are two types of development that I want to mention here, two types of bone development. You have endochondral ossification and intramembranous ossification. So we're really going to focus on the steps involved in endochondral ossification. We will not go through the details of intramembranous ossification. That is actually a whole different process. we're really going to focus on the first one here because this is what forms most of the skeleton, so the long bones, all right? And again, this endochondral ossification is when you see this bone replacing hyaline cartilage. And yeah, remember that endochondral ossification is the kind of bone development that we're seeing happening in long bones, most of the skeleton. So intramembranous ossification, although we're not going to go through the steps of it, you should be aware that this is how flat bones form. And it is a different process. Again, we're not going into. Just know that there is this second type of ossification, and it's going to be occurring in flat bones. So this would be like cranial bones, for example. All right, so we're going to jump in here to the steps involved in endochondral ossification. There are 5 main steps. You should know all 5 of these. You should know what is going on in each of these phases. So what I'm going to do is just jump to the picture of it and go through the picture with you. The slides don't want to change for some reason. My computer is slow right now, I think. Bear with me. Wow, really slow. Hold on. I'm not going to have technical issues. Okay, here we go. So yeah, let's look at this picture here that's illustrating each of the steps. So first of all, okay, you have cartilage, all right? And so what it's showing here in blue here for this first step is that you have a hyaline cartilage model, all right? And what they're showing here is, let's say this, for example, is part of a phalange, all right, or maybe part of a metacarpal bone, okay? It's a long bone. And so what you'll see there is that there's this model, okay, of hyaline cartilage. So the first thing that's going to happen is, yeah, we have this little model here, and around that we'll start to form a perichondrium. Remember, this is hyaline, this is cartilage. So around it we will find perichondrium. Okay, so that's basically what we're dealing with in the first stage. Now in the second stage, what's going to start to happen is that you get the development of what's called a primary ossification center. The primary ossification center is going to be located right in the middle of this hyaline cartilage model. Okay, so the primary ossification center exists or starts in will eventually be the diaphysis of the bone, okay, or the long middle of the bone. What else do we see happening here? We start to see the development of what's called a bone collar. So a little bone collar, okay, and what this is just a little area that has ossified, all right? It has ossified. So the outer edges of that hyaline cartilage model start to ossify, and that's called the bone collar. Then we start to see, since we have a bone collar developing around the edges here, that we also start to see that this perichondrium is now converted into periosteum. Okay, so now we have periosteum. So here in our second stage, we're seeing the primary ossification center develop in the middle. We're seeing the development of a bone collar around that, to the sides of that. And then we're going to see a conversion of the perichondrium into periosteum. All right, so at the third stage, now we're going to start to see that this primary ossification center has developed even greater. And the reason for that is because we have now had the invasion of arteries, okay? This is really, we're going to say this is a nutrient artery. So a nutrient artery that has a lot of nutrients is going to invade primary ossification center, okay? And then what we're going to start to see is the development of a cavity here, all right? We're now starting to see that the primary ossification center has expanded into a cavity, okay? We will see that osteoclasts are going to be here down any of this here, okay, to form a cavity, a marrow cavity. Now, also at this stage, you start to see the appearance of a secondary ossification center. The secondary ossification center is going to be located in the epiphysis, what will be the epiphysis of the bone. All right, so now, next stage. Now, keep in mind, it does say here, kind of like when this is happening. So at this stage, at stage 4, this is at birth. So basically, by the time you're born, this is the condition that your bone is in, okay? So what we have, look at this. In the middle here, we now have a full diaphysis. We have blood vessels here in the middle. We have a medullary cavity in the middle, all right? And now we can store our yellow bone marrow in there, all right? We have a fully formed diaphysis, okay? And now at the ends, what we're going to see at the epiphyses, we're going to see further development of these secondary ossification centers. Remember, there will be a secondary ossification center at each epiphysis, So just like we saw with the primary ossification center, at the secondary ossification center, you start to see the invasion of vessels, okay? Blood vessels are now coming into this area, and they're going to be providing nutrition to help further develop these epiphyses. Okay, now at stage 5, this is a child's bone will be like. Okay, a child's bone, yes, we have a fully formed diaphysis. All right, and we will see the epiphyses fully formed. Now, it says down here metaphysis. Don't worry about that. We're not going to get into that. But what you want to note here is this really important structure. We start to see what's called an epiphyseal plate. Okay, I mean, basically, a metaphysis is the pre-version before it becomes the epiphyseal plate, if you want to know that. Okay, but eventually, so when you're actually a child and you're developing, you do have this epiphyseal plate. Now, the epiphyseal plate is going to be at both ends. So you'll see an epiphyseal plate here between this epiphysis and the diaphysis. You're also going to see, and it's not showing it here, but you're also going to see a fully formed epiphysis here at the bottom as well. And at that intersection of this epiphysis at the distal end and the diaphysis, between those, you will also see an epiphyseal plate. So you will have an epiphyseal plate at the proximal part of the bone. You will also have an epiphyseal plate at the distal portion of the bone. And so what's going to happen is that this bone is going to then begin to grow in length, and this is what makes us taller, right? And all of that activity will be seen at the epiphyseal plate. Okay. Bone growth and length is all about what's happening here at the epiphyseal plate. That's how we grow tall, is based on the activity here at this little plate. Now, as an adult, here we are, all right? Now, at this point, you know, everything's fully formed here. And note that when you're done growing in length, okay, or when you're done growing tall, instead of the epiphyseal plate will ossify eventually. Okay, because the epiphyseal plate is actually cartilage. But by the time you're finished growing, so we're talking late adolescence to early adulthood, that epiphyseal plate will calcify, and it will become then known as the epiphyseal line. Okay, so that means at this point, once you see the epiphyseal line, there will not be any more growth in length of this bone. It is done growing in length once you see the line, because the epiphyseal plate has calcified. Okay, there's no more cartilage there. So at this point, the only place you should see cartilage is going to be on the very outside of the epiphyses, right? And this would be the articular cartilage, which is hyaline cartilage. So as an adult, you're only going to see this cartilage around the bone at the ends, at the epiphyses, at each end. Now let me go back let me go back and just make sure we covered everything for each of those steps, right? So the first step, we're really just dealing with the fact that we have a cartilage model, and it's going to be surrounded by perichondrium. At the second stage, we see the development of a bone collar that's just forming around the epiphysis, around that cartilage model. Also in stage 2, you're going to see the development of a primary ossification in the middle of the diaphysis. You also are going to see the conversion of perichondrium that was around that cartilage model. You're going to see that converted into periosteum, because now we have this bone collar. At stage 3, then, we're starting to see calcification of the diaphysis. Okay, we're starting to see a calcification. So when we say calcification, we're talking about the depositing of calcium. That's what calcification means. Okay, so again, this is why especially when you're growing tall, that they say it's important to have enough calcium in your diet as a child, right? That it helps bone growth. Why do you think they say milk, it does the body good, right? Well, yeah, because, you need to have plenty of calcium for bone growth, all right, in length. All right, so here at the stage 3, again, we're having this calcification of the diaphysis and the development of the medullary cavity. Okay, the diaphysis will end up forming inside of that diaphysis. You will find the medullary cavity. Okay, so we have diaphysis calcifying, and then remember, we're going to have osteoclasts. Now remember what osteoclasts do. Osteoclasts break tissue down. They break bone tissue down. So we are going to have osteoclasts involved here in sort of breaking this diaphysis down in the middle so that we can have that medullary cavity in there. Also in stage 3 is really when we're going to see our blood vessels entering the diaphysis, okay? And they're coming in there to provide a lot of nutrition and things that we need to develop and to be able to transport calcium to the area, for example. You're also going to start to see the development of a secondary ossification center in the epiphyses. Now remember, the secondary ossification centers will be in both epiphyses, all right? Both the distal and the proximal epiphyses. Well, the slide, there we go. All right. All right, so stage 4, we saw that this was the state of the bones at birth. And so at this point, the medullary cavity should be completely formed within that diaphysis. And then during stage 4, you're just seeing a continual development of the secondary ossification centers. All right, so at birth, diaphysis is fully formed. Epiphyses are still forming. Okay, so the ends of the bones are still forming. Now at stage 5, this is dealing with childhood and adolescence. Okay, so stage 5, this is a long time, right? So we're dealing with early childhood, right? So when the child starts to grow taller, all the way up to late adulthood, late adolescence and early adulthood. So number 5 really is lasting a long time. Here we're having the epiphyses ossify, okay? And we're having a lot of activity here at the epiphyseal plate, all right? Again, here during this stage, this is the longest period of time because you were having growth of the bones. You're growing taller, and that is due to activity specifically at the epiphyseal plate, okay, which again is going to be existing between the epiphysis and the diaphysis at each end. All right, this epiphyseal plate is made of hyaline cartilage, and we're going to look at this epiphyseal plate. There's actually different layers or zones to it, and it's all basically cartilage. Okay, and so what we're having is that cartilage in that epiphyseal plate differentiating and growing and growing and growing, making more and more layers of cartilage, and then eventually those layers of cartilage get converted to bone, and that's how we're growing in length. Okay. Now, as the adult, okay, the epiphyseal plate is closed. All right, it's no longer active. All right, there is no longer cartilage there. The cartilage there is now all bone. It's been ossified, and you can actually see this epiphyseal line on X-rays. All right, you'll notice that there's a little line there. You know, epiphyses and the diaphysis at each end, and that represents where that epiphyseal plate used to be. So at this point, once that epiphyseal plate closes, or once it calcifies, there is no more growth and length possible. Okay, but okay, based on physical activity and diet, growth in width can occur. Okay, but you're not going to have your bones get any longer after this point. But again, you can have growth in width. Okay, so study this picture along with those stages, because I'm sure you'll have a question or two about what's going on in each of those phases. All right. So yeah, during infancy and childhood, the epiphyses will fill with spongy bone. All right, and again, cartilage is going to be eventually limited to articular cartilage. That should be the only place that you'll see cartilage. And then as a child, you'll still see that cartilage at the epiphyse. Okay, and again, you know, I've really already said this. You know, the epiphyseal plate will persist through late adolescence to early adulthood. And so the epiphyseal plate is a growth zone, okay? It's considered a zone of growth, and that's how we're going to have our bone elongation occur. So as it says here, by late teen to early 20s, okay, you should have all of your epiphyseal plate activity finished, all right? And really, I've already said this. Look, if it's not underlined, some of that's there just, you know, for your interest, but I've already said this, okay? So a lot of this is actually repetitive. Here's just a picture of a fetal skeleton at 12 weeks. And so, you know, keep in mind, you know, we're forming, all right, but, you know, at 12 weeks, there's still a lot of places of cartilage. So you can kind of see where this is, especially in the cranial, with the cranial bones, all right? The cranial bones, yeah, they're bony, all right? But there's still a lot of cartilage here. These bones have not fused together yet. This is why on a baby, even at birth, all right, these bones have not fused yet, all right? So you have like what are called soft spots up here, right? You gotta be real careful with the baby's head because that's still cartilage up there. All right, so the epiphyseal plate, there's something called interstitial growth. Interstitial growth just means growth from within. And that's the kind of growth that you can say is happening at the epiphyseal plate. So again, what's going to happen here is cartilage at the epiphyseal plate is going to be converted to bone throughout childhood and adolescence. And this is how the bone elongates. Okay, and again, a lot of this is repetitive. I probably need to change this lecture to take some of this out because it's just saying what I've already said. Now, activity at the epiphyseal plate does vary, though, based on gender, all right? And that's due to different hormones. testosterone and estrogen have different effects, different but similar effects. And, you know, when this epiphyseal plate disappears does depend on age as well, as you know. All right, so the next couple of slides deal with the specific layers of the epiphyseal plate. Yes, we can break the epiphyseal plate down into 5 different regions. And definitely want to know these 5 regions in order and something that's going on in each layer. All right, so let's just go through each of these 5. So the first layer, or the first zone, or first growth zone of the epiphyseal plate is called the resting zone. The resting zone is just what it sounds like. It's an area of cartilage that's pretty inactive, all right? It's resting. It sort of just serves as a cartilage boundary between the epiphysis and the diaphysis. Okay? Well, let me say that differently. What you want to know, because you want to know this in order, all right, these zones in order. So let me say it differently. The resting zone is the zone that's on the epiphyseal side. Okay, it's on the epiphyseal side of the epiphyseal plate. Okay, the 5th zone, the last zone we're going to see, is going to be closest to the diaphysis. Okay, so remember, this is at both ends. Okay, so the resting zone is the zone facing the epiphysis on each end, and it's just relatively inactive. That's why it's called the resting zone. So if you go down, okay, or up, depending which epiphysis you're at, all right, but the zone after the resting zone, so we're basically, from the resting zone, we're getting closer to diaphysis. Okay, that's the order here. We're going from epiphysis and approaching, getting closer to diaphysis. Okay, so then layer that's next closest to the diaphysis then is the proliferation zone. Proliferation. So it's easy to remember the names of these stages as far as, like, you know, what's going on in each, because what's going on in each zone is illustrated by its name. Okay, so the proliferation zone, well, that tells you this is a zone where we're having cells proliferate. We're having growth here. What we're having growth of is cartilage, though. This is not bone growth right here. Remember that the epiphyseal plate is made of cartilage. Okay, so this particular zone, we're having rapid division of cells, of cartilage cells. Okay, so basically we're having chondrocytes divide. We're having rapid cell division of chondrocytes. Okay, and so these new chondrocytes are what they're gonna do is just physically, just mechanically, because we're having so many of them divide, that is going to result in the epiphysis getting pushed further away from the diaphysis at both ends. So this is what's causing the lengthening of the bone, is really this high amount of chondrocyte cell division in this proliferation zone. Okay, so it's kind of cool how that happens, all right? It's the cell division itself pushes the epiphyses away from the diaphysis. Third zone closest to the diaphysis. Remember, we're going from epiphysis to diaphysis. So the third zone, as we start to go towards diaphysis, is the hypertrophic zone. So hypertrophic. We have mentioned what the word atrophy means. Atrophy means, maybe you remember, atrophy means that we're having a decrease in cell size. And eventually that will result in the dying off of that cell. This is similar. Hypertrophy. So when you have hypertrophy, what this means is the opposite, sort of. it means that a cell is getting larger. Instead of getting smaller, okay, the cell is getting larger. It's undergoing hypertrophy. And so that's what you're seeing in the hypertrophic zone, is that all these chondrocytes that formed, all those chondrocytes start to get really large. Okay, these are older chondrocytes. They are getting really large. And so what happens when you have a cell get really large, it becomes unfunctional. And so it will die. All right. Same result that you see with atrophy. Like with atrophy, you're having the size of a cell get smaller. Okay. And that's going to result in the cell dying off, and it's going to, result in a lower cell population. Hypertrophy means the cell's getting too big. And same thing, it's not functional then either. All right. So it will die off. Okay. So in the hypertrophic zone, we're having large chondrocytes. And because they're getting larger, they're going to start to die off. So the lacunae that were holding the chondrocytes start to erode, okay? And we're going to have a dying off of these chondrocytes because we're getting closer to diaphysis, which means we need that to be bone there, all right? So the next zone closest to the diaphysis is the calcification zone. Again, look at the name of the zone to tell you what's going on in it. In the calcification zone, we're having calcification, right? Here, chondrocytes are continuing to die off, and we're having a calcium deposition happen here, right? So we're having the actual conversion here of cartilage to bone at this point. Now, the last one is the ossification zone, and this is where we're having active ossification going on. Okay, osteoclasts are going to be there, degrading whatever is not bone, all right, or unorganized pieces of bone tissue, these which are called spicules. The osteoclasts will come along and degrade all that and make it so that we can have an organized bone tissue. Okay, and osteoblasts will be there depositing calcium, and we're going to have, and depositing osteoid, okay, depositing the matrix that makes up bone tissue, okay. So at this point, our chondrocytes are pretty much all, or they're dying, all right, and this is the region closest to the diaphysis. So let's just look at a picture of this. You won't be asked to identify by sight what these layers look like. This is a histological view here of the epiphyseal plate, all right? Now remember these in order, okay? So the zone closest to the epiphysis is the resting zone. And remember, there's really not a whole lot going on there, okay? It's just sort of like a boundary between the epiphysis and where we start to see cartilage activity, all right? Then you have the proliferation zone. Okay, so remember, we're going from epiphysis down to diaphysis. Okay, down to diaphysis. So next we have proliferation zone, and here what you're seeing is we're having a lot of mitosis. Chondrocytes are dividing. Okay, they're dividing into more chondrocytes, more and more chondrocytes here, and so they're going to look like they're stacked on, like stacked coins. They like to sort of stack on top of each other. Okay, so you'll see that kind of appearance. Next, we have hypertrophic, and as you can see, look at our chondrocytes here. They're undergoing hypertrophy. They're getting larger. All right, so they're getting bigger here. And then we have this layer here of calcification. Okay, we're getting closer to the diaphysis at this point. And then we have our ossification. So here we're having osseous tissue be laid down by osteoblasts, right? We're going to have osteoblasts line down our matrix for the bone. Again, you're not going to be asked to recognize any of these by sight, but you should know what's going on in each stage, all right, and the order of these from epiphysis to diaphysis. Here's another picture of it that's color-coded and, with more, again, giving you a summary of what's going on in each stage. So that's just another way to look at it. Okay. So again, eventually this epiphyseal plate is going to close or be completely ossified. At that point, it's called the epiphyseal line. Now, you should know this number here. You should know, you might have a question on when bone lengthening stops. All right, so for females, it's younger. Females are going to stop having bone growth and length at about 18. All right, maybe it's 17 for others, maybe it's 19 for others, but it's usually around 18. For males, it's a little later. For males, it's going to be about 21. All right, so that was about bone growth and length. Now, as I mentioned, based on your lifestyle, okay, based on what kind of stress you place on your bones, based on physical activity, okay, based on muscle activity. If you make muscles bigger, let's say you lift weights and you're increasing the size of your muscles, then that's going to place stress on your bones, and that's going to cause your bones to grow in width. All right, they're going to get thicker. Osteoblasts will secrete more bone matrix, okay? This is more going to be on the external surface of the bone, okay? Osteoclasts throughout life are going to be removing bone, okay? So what we're going to see is that these osteoblasts and osteoclasts, there's like an interplay between these two throughout life, okay? What about hormonal regulation? Definitely want to know the hormones involved in bone growth. Next semester, when you do Bio 139, you will study in detail the endocrine system. When you do that, you will learn much more about all of these hormones, okay? But I'm not going to ask that you know a whole lot about them right now, just that they're involved in bone development. You should definitely know that the most important hormone for bone development is growth hormone. Okay, and that is because growth hormone has a direct stimulatory effect on the epiphyseal plate, okay, during childhood, right? So growth hormone, you're going to see an increase in the secretion of growth hormone throughout childhood, okay, so that we can have an increase in bone length, all right, at the due to activity at the epiphyseal plate. Okay, keep in mind, people talk about these growth hormone stuff, taking growth hormone as an adult. It's really not a good idea because it has a very negative impact on a lot of different systems of the body. And what it can do is actually cause your flat bones to grow bigger. All right, so a person taking GH supplements eventually is going to have like really large they're going to have very large facial bones. All right, they might even develop larger cranial bones, and they just are not going to look very great because, they're going to change their whole appearance, and it may not be for the better. All right, so be careful with that growth hormone because it can have some negative effects on bone as an adult, and it's not normal to have high levels of GH in the adult. It's not normal. It is normal to have higher levels of GH in the child for this reason, for bone development. But once that epiphyseal line is there, you don't need this GH anymore, right? Okay, GH is going to end up having negative impacts elsewhere. Thyroid hormone, you should know thyroid hormone is involved with bone development. It's really complicated. So, we don't need to know the detail about it. Just that thyroid hormone works with GH, okay? It works with growth hormone. It sort of helps model the activity of growth hormone. So there's crosstalk, a lot of crosstalk between thyroid hormone and growth hormone while you're growing up to help really mediate and keep in control the activity at the epiphyseal plate. Other hormones involved, testosterone and estrogen. Okay, so at puberty, you have a increase, right, of testosterone and estrogen. at puberty. And so that's why you notice that at puberty, you have this growth spurt, because testosterone and estrogen are going to play a role in the epiphyseal plate activity. Now, but also understand that these two have an opposite effect later on. Okay, later on at early adulthood, these two are going to play a role in stopping activity at the epiphyseal plate. Okay, now obviously, and this is the case with any hormone, if you have too much secretion or not enough of a hormone, it can cause abnormal skeletal growth and abnormalities all over the body. All right, which is why, you really want to like never take a synthetic hormone. You never ever want to do that unless you have a deficiency in it. If you have a growth hormone deficiency, then yeah, maybe the pediatrician and maybe other physicians later on will want to give you growth hormone um, supplements up to a point. All right, up to a point. Okay, so again, never a good idea to take synthetic hormones unless you actually have a physiological deficiency of them. Otherwise, you're really going to mess with things. All right, and not much about this slide. Again, factors affecting bone growth. Remember, estrogen and testosterone have a role, but estrogen actually has a stronger effect than testosterone on bone growth. And this is why you see that girls will actually reach their full height earlier than males. Okay, but males, their testosterone will have a longer lasting impact, which is a little bit slower. So the males will catch up. They will eventually be than females typically, but they will not reach that maximum until a later age compared to females. And again, that is just based on how estrogen and testosterone secretion differs throughout life, especially through adolescence. Okay. And again, estrogen and testosterone are going to play a role eventually in closing off that epiphyseal plate. Last slide here is about bone remodeling. And so remodeling is going to involve like an interplay between osteoblasts and osteoclasts. So you can have resorption happening and deposition happening. And this is happening all throughout life. Now, normal bone remodeling is always happening. And it says here like 10% of the skeleton per year. So basically about 10% of the skeleton per year is actually remodeled completely, all right, due to the activity of osteoblasts and osteoclasts. Osteoclasts will do a normal level of breakdown of bone tissue, and osteoblasts will do like a normal level of bone deposition, all right, and they just sort of like work together. Okay, so yeah, you're getting like a replenishment of bone tissue throughout life a little bit. All right, and then of course your diet, okay, and your activity, injuries, okay, if you've had injuries, will help reshape the bone. There's something called Wolff's Law. Wolff's Law is actually a law that describes how mechanical stresses affect how a bone remodels itself. Okay, and again, main idea with this is that osteoblasts and osteoblasts play this collaborative role in the remodeling process. Okay. Also, again, back to the idea of that, the more stress you place on your bones, the more the bones will respond to that and remodeling and growth and thickness as well. Well, also projections on your bones that are serving as attachment sites for muscles, for example. Well, if you weightlift, okay, or exercise, especially if you're weightlifting and you're building your muscles up, that is going to cause the attachment sites on your bones to become larger. All right. So again, this demonstrates how the bone responds to your lifestyle. And this last slide is actually a repeat. I'm not sure why, but it's a repeat. So it's actually 21 slides here. So that's that for bone development. Okay, the main ideas for this lecture were the stages of endochondral ossification, knowing what's going on in each stage, and then the growth zone, the zones of the epiphyseal plate. I would say those were really the high yield topics for this um, lecture. All right, so that's the end of it, and I will have your part 3, which I hope you will all find very interesting. Part 3 is all about calcium homeostasis, really important topic, and pathology. We'll talk about the bone diseases. So uh, we'll have more fun with that probably. Okay, but you have the basics and the foundation. Now you're going to be able to study that one. Okay, have a good one. Bye bye.